We are joined today by Shella Beauzil, who is going to share her cancer caregiver journey with us today. Shella, thank you so much for being here. Let's start off by you just telling us your story.
All right. So my mother was a person who I was a caregiver for. She had ovarian cancer. And she was diagnosed right after I graduated college. And
Yeah, so that must have been tough. You were in college and you were a caregiver for your mom?
Yes. Well, actually, after college, once I graduated, that's when she had more appointments to go to. She was actively being treated for the cancer. But before, she had some symptoms, but she didn't know what was going on at that time.
So when your mom was diagnosed with ovarian cancer, now I know they were taking care of her. When I say they, I mean the healthcare professionals at the hospital. Do you feel like they were there to support you as a caregiver?
No, I don't think it was very everything was more geared to the patient and everything that they plan to do, and everything goes very, very quickly. So from the point where they have the diagnosis to surgery, everything is rapid.
Yeah. Do you feel like you were kept informed about what was going on? Even at the beginning, her diagnosis, educated about that, what the treatment plan was at that time when it, had to change? Do you feel like they kept you informed?
I felt like even if they tried to keep me informed, I was still in a daze. I was still shocked, very numb by everything. So it's hard to absorb that kind of information. I did do a lot of my own research, which probably was they advised against that. I remember that. But yeah, I didn't really understand too much except for the basics. She's sick, we have to have surgery, and then she's going to have chemotherapy.
Right. So what was your biggest challenge as a young cancer caregiver to your mom?
The biggest challenge for me was just to watch the physical effects of the cancer and the chemo. It was really the chemo that was hard.
Yeah, that can definitely be tough on the body. Almost making you feel kind of helpless, right? Because what can you do? Yeah. Right. Did you talk to your mom about your concerns that you had regarding her diagnosis and or treatment?
Yeah, I talked to her. My main concern was losing her, and she was the type of person that was she tried her best to be proactive. So, in a way, when I look back, I feel like it, being she's a patient, she's the person who has the cancer, but also as a mother, she still cares about me, my sister, her granddaughters. So I don't know. I don't know if I answered your question.
You did. So where did you find support? Where did you find, what was your outlet? Where did you find support? Was it online? Was it friends? Was it family? Or was it just you kind of stayed by yourself and dealt with it alone?
Oh, no. I definitely had the support of my family, of my friends. I was really into yoga. That helped me a lot. I was practicing really good self-care at that time, which was definitely a blessing. But yeah, I had my family were a huge help. Again, I was in a daze, so there were so many hands to help.
Yeah, no, that's really good. And that's one thing that, caregivers always say, it's really hard to provide self-care because you don't have anyone to help. So how did you incorporate that into your schedule? Was it you put it on the calendar, or, you just had things you did on a daily basis? How did you make time for that?
At that time, I was really structured because I was in school. So I had like, I pretty much had an agenda Monday through Friday. And I was able to just like plug in, okay, this is when I'm going to yoga. I have to study. I have to go to internship. I was very busy. And I think in a way, having a lot to do was, it was good because it didn't really give me a chance to really sit and let everything sink in. Mm-hmm. At the same time, like I probably needed that every now and then. Mm-hmm. But yeah, I was just very structured. I had like a set schedule.
Yeah. No, that's really good. I think it's important to provide the self-care because, I'm a true believer that you can't take care of someone unless you take care of yourself. Well, you can, but it's harder. It makes it a little harder if you're not physically and mentally functioning at your optimal level. If that makes sense. Yeah. So what could the healthcare team have done to really enhance your experience as a young cancer caregiver, if anything?
I think just provide a space for caregivers to just have a time to process what's going on and like have somebody to talk to as far as like, I'm going through this and just kind of validate or confirm like, yes, this is happening and
yeah.
Safe space.
Give you time and space to just acknowledge that you are going through something too. Right. Yeah, it's in the research that, cancer caregivers have high levels of emotional stress, physical stress, insomnia, depression. Cancer caregivers deal with a lot. So it is really important to provide them the opportunity to kind of talk about what they're going through. Right. So that's very important. So how are you doing now?
Now I'm much better. It still feels like yesterday. It's been 5 years. She passed May 18th, 2015. Mm-hmm. And I'm happy that I found comfort and have been able to like move on, but I still definitely miss her. And even though it was hard being a caregiver, I am so happy that I was able to do that because I have no regrets. Like I did everything I could and I'm happy with that.
Yeah. So when you were a caregiver to your mom, how did you capture those, I call them golden moments, those moments when it's just the two of you? Did you intentionally do that? Do you remember? Or you just have fond memories? Because when you said that, you looked very happy when you were saying that. You're just happy that you were able to provide that care to her.
Those moments happen naturally. Me and my mother were so close, my best friend. Yeah. So like that was easy just to be with her. We used to take lots of naps together because I was always tired. I was always running around somewhere, so I would take naps with her. And, there were lots of good moments, but, there were times where it was tough for me to you asked me what was the hardest part of everything. And the hardest part is just watching your loved one deteriorate and their body kind of, get eaten up by this disease. And sometimes it's literally hard to just sit. For me, it was hard to just sit in the room with her and see that and just think, 2 days ago, you didn't look like that. You lost more weight or, you have less energy. I could see it. Because it obviously would make me feel sad. It would make the whole situation more real. But, and I think it's important for caregivers to be aware that sometimes you'll have feelings that you're kind of, you might feel like I shouldn't feel this way, because I feel bad that I don't want to sit here right now and watch my mom because it's making me sad. I need to leave. I shouldn't feel that way because she's the one who's sick. She's the one dealing with it. But self-care is being able to, recognize that and do what you need to do. So like you said, you could be at your optimal level so you can be a caregiver.
Yes.
So, whenever I would have those feelings, I think as a mother, she was just so in tune with me that she didn't she wouldn't give me a hard time about it. She'd be like, go enjoy yourself. It's a nice day, and go hang out with your friends, come back. Of course, I'll come back.
Yeah.
When I'm back, we have those moments. Yes, it's an emotional roller coaster. It's not even a roller coaster. You know the elevator in Six Flags, the thing that goes up and down? To me, that's what it seems like.
Yeah. So it sounded like I was thinking guilt. Like you felt kind of guilty because you were feeling that way. Is that fair to say?
Mm-hmm.
Yeah, but your mom kind of nurtured that and said, "Go ahead, it's fine." Kind of gave you permission to go.
Yeah.
Yeah. Did you feel okay when you were out, when you left, or were you still kind of thinking about what was going on at home?
I would feel bad. Bless you. I would feel bad sometimes about leaving.
Yeah.
If I felt really bad, I would just come right back.
Mm-hmm.
But there was one time where my aunt had come to visit, and she came to help, and I was like, okay, you're here. I just got back from wherever. I'm going to go to this yoga class. I'll be gone for an hour and a half tops. So I go to my yoga class. I leave my phone in my car, finish my class, come back, and I have messages. And my mom, she passed out. And my aunt was so shocked and just overwhelmed that she forgot the number to 911.
Oh.
Yeah. Luckily, our neighbors, she was young, help. She got our neighbors' attention. They helped and carried my mom out of the bathroom, called 911. So when I came home from that, I was like, I feel bad. I should have stayed. Anything could have happened. But my mom and my aunt were just things happen, and luckily your neighbors were here and everything was fine.
Yeah.
Yeah.
Well, that shows the example of when you're so stressed and scared, you can forget simple things like 911 because you don't know what to do, right? You don't know what's happening. So, and even if you were there, the same thing could have happened, and you probably would have forgot the number to 911,
Right.
So who knows? But thank God someone was there, So that's awesome. No, that's really good. So Shella, if you could, give some points to some individuals who are maybe young caregivers caring for a loved one, what's some advice you would give them?
I would definitely encourage them to feel their feelings, be aware of it, good and bad, because a feeling is a feeling, and try to find at least one person who could be supportive and you could feel comfortable talking to process things with, and definitely find something, an outlet, whether it's working out, reading, journaling, something that you can, something that's free.
Right.
Do at any time, if you need to center yourself.
Yeah. Do you think it would have helped you if you had a group or a support group or community, or like you said, that's someone you can go to and meet with on a weekly basis to just kind of talk about your feelings, whether they're good, bad, ugly, indifferent?
At that time, I don't think it would have. I had so many. The good thing about having so much support is that, like, you have people all around who you can talk to. But on the flip side to that, sometimes it's just too much. That can be overwhelming. Everybody asks me, what's wrong? What's wrong? Talk to me, talk to me, talk to me. And that's why I think, like, if you can find another outlet that you can do something that can kind of help you unravel your mind. I think what would help me more was, you know what, maybe not like a weekly session, but more of just like a check-in, either online or to write something to somebody, or
just like you checking in with someone, and with someone like just checking in with you.
I guess it could be somebody checking in with me. It could be me checking in with someone. Just an opportunity to, like, think about how I'm feeling, what's going on. Because life can be everything can move so rapidly that you forget to, like, just stop and just be aware of what's going on.
Yeah, and, you know, I always feel like a cancer diagnosis, it really shifts your life because you're living your life day to day. Then a loved one is diagnosed with cancer and everything just shifts automatically, right? Like you said, you were a student, you were in school, but your life was still shifting even though you're going to school, right? And then you have to incorporate trying to be a caregiver and deal with, you know, so many things that come with that. Can be really tough, right?
A lot of hats. It was a lot of hats to where you help with taking care of for me, it was taking care of the house, making sure the bills are paid, cooking and cleaning, and just pretty much feeling like you have a dependent.
Yeah. You do, because you're the caregiver. You're taking care of everything, you know. Shella, did you ever ask for help?
Yes. It was more like people would ask me, do you need help? And I would be like, yes, I accept it. Please come help me. A lot of the time, I felt like I didn't even know what I needed help with because I was just so overwhelmed and numb. But, like, when my aunt came that time, even though a situation happened, she wanted to help. And I was like, yes, please, we need you.
Yes, well, that's good. That I commend you for that because as cancer caregivers, it can be hard, one, to admit you need help, and two, to really accept the help. So that's really great that you were able to say, yes, I need help, and here, this is what you can do. One thing I do advise caregivers to do is make a list of, like, tasks that you are willing to delegate. You know, so when people say, do you need help? Yes, you can do X, Y, or Z. You know, go to the list and say, because some things you're willing to delegate, other things, you know, you're really not willing to actually delegate. So that's good. Good for you. Good for you. Now, do you have any parting words? We're going to wrap this interview up. Any parting words before we leave here tonight?
I think that being a caregiver is a very, very special role that you could play in your lifetime. That personally for me, it was something that it helped bring me comfort, and it still does give me comfort sometimes when I miss my mom.
Yeah, that's nice. That's beautiful. That's beautiful. That in my mind makes me think you have those golden moments that you can think about and, you know, just lean on a little bit when you need to. That's awesome. Well, Shella, thank you so much for your time. I appreciate you agreeing to do this interview, and we'll talk soon.
Yes.
All right.
Thank you.